one thing we can say about CBD is that your endocannabinoid system, and if you recall back to our previous podcast, your body makes its own cannabinoids. And these cannabinoids play a very close relationship in monitoring that circadian rhythm that I mentioned earlier. And that's really why I mentioned it. It's your body's internal alarm clock, its internal systems of functioning, and it appears to depend quite heavily on the health of your endocannabinoid system. So if we can take CBD, if we can promote healthy endocannabinoid levels, it does appear to have a very positive impact on that circadian rhythm, which then in turn impacts our sleep-wake cycle. So we're seeing that, we can say that confidently. Now, most of the positive stuff when it comes to CBD, I wish I could sit here and say it affects this receptor and we know that serotonin is produced and that's why we're getting a deeper sleep with CBD. We don't know that exactly, but what we can say about CBD is this. It has been shown to have antidepressant effects. It has been shown to have anti-inflammatory effects. It has been shown to have effects on anxiety and PTSD and helping those. And we're seeing clinical things being done in that setting on those effects. We know if we have less anxiety, we're going to probably be able to sleep better. One of the first questions I ask patients when we're going through a treatment plan is, how is your sleep? I had back pain that was waking me up at night, and now that pain is no longer waking me up during the evenings. That's a great sign to me that we're on the right track. I know we're going to have success with that patient right away. So if we can utilize CBD to help block some of those pain signals and get that person a better night's sleep, we know we're going to have a better prognosis for that individual, a better outcome for that individual. If they are suffering from depression or PTSD, this is where CBD can be a huge help. People who are chronically depressed, people who are bipolar, if they can get relief from some of those symptoms of depression, bipolar disorders, PTSD, their sleep is going to be better. We didn't go too much into sleep and PTSD last time, but I think a lot of our listeners who suffer from that will tell you, I wake up with night terrors. They'll wake up from a sound sleep during that REM cycle of sleep and they can't fall back asleep. They're terrified. They're sweating. Their heart rate is up. There's been releases of excitatory neurotransmitters and hormones. If CBD can help alter that, that's a great thing for that individual. So I wish I could sit here and say we know exactly how CBD affects sleep. We know exactly how it works. What we can say is this: the endocannabinoid system does seem to play a large role in balancing our sleep-wake cycle. We don't know exactly how, but for right now, it appears to be very positive. And I can tell you from a standpoint of my patients, the amount of people that I come in and they say, I haven't slept like this in 20 years. I sincerely hear that from people all the time. They'll say, I wasn't dreaming and now I did dream again in a very positive way. That's a great thing. And at the end of the day, I understand right now scientifically or clinically, we can't look and say, hey, you had a deeper sleep. But if someone's coming in and telling me I'm more alert at work, I'm more focused, I have less pain, I'm going to go out on a wild guess and think down the line, we're probably going to see that it was beneficial for deep sleep. I'll just say a side note about THC again, even though it's not where we're focused. People who do smoke, people who smoke chronically, when it comes to THC, there may be some benefit to that when it comes to PTSD. Some people may actually want to try and suppress some of their dreams or night terrors. Just talk to a physician about that, okay, when it comes to medical marijuana. There may be some benefit. Long term, though, we certainly don't know the effects of chronic THC usage on sleep. So I'm just throwing that out there. While we're talking about CBD too, I find this to be a great solution because let's say we have, and I see this all the time, let's say we have a patient who isn't sleeping because they have pain. So I hate to say it, in the primary setting, it's probably going to be medication-based, or more commonly we see over-the-counter sleep aids prescribed, which basically is Benadryl. And the primary ingredients in Benadryl will actually stunt the release of certain hormones that we need and certain neurotransmitters. One specifically, when we see in pain patients, it's the acetylcholine. And that's vital when it comes to making bowel movements. People on opioids, they usually have a problem with bowel movements. Now they're taking an over-the-counter sleep aid. Now they're having a larger problem with bowel movements. They're in pain. Maybe they're taking a combo sleep aid with acetaminophen in it. I see this all the time. The liver damage that they're potentially putting themselves at risk for. And let's make matters worse by saying it's that individual who's doing the nightcap with a glass or two of wine, with a few beers, a liquor drink. and now we really have a recipe for disaster, right? We have the issues with the GI system. We're facing the liver issues from the acetaminophen, and of course, the combination of the alcohol. Because as we know, a lot of people who don't sleep are prone to consume more alcohol. And I want to say this too. People need to realize that, and I think I emphasize this in most of our podcasts, chronic sleep will catch up to you over time. If you deprive your body enough, as to your point, it will shut down eventually. It will stop. Now, it may be in the form of you just collapsing one day at work and falling asleep like someone who has narcolepsy, or it may be a different system. The one I see very often in the setting that we work is actually cardiac events. If we have someone who's been consuming a lot of alcohol over years of time, you're going to notice water weight starts to accumulate over around the heart. They're constantly yawning. Their body is begging for oxygen. It's begging for sleep. And what happens in that case? The heart eventually gives out. So I hate to say it, sleep isn't often discussed in a typical medical setting. And this might actually should be the forefront of things, because if we fix sleep, we might be able to fix anxiety, depression, cardiovascular disease, diabetes, and all these things just feed into each other. Most people I recommend start at that 5 milligrams to 60 milligrams and see how you respond. Now, I actually do have a number of people too, where maybe we just couldn't get it right at night for them. I'll tell them, take it in the morning and the afternoon, and actually don't take it before bed. Maybe just do your dosage of, let's say they're taking a dosage of 20 to 40 milligrams a day. I'll say, look, just take it at lunchtime and let's see how you do with that. And a lot of those people actually come back and say, hey, even though I didn't use it before bed, I'm actually sleeping much better. And again, the dosage is so individualized. Just a little gold nugget there. I've kind of noticed, again, women who have not gone through menopause, and someone might disagree with me on this, that's fine, but I've noticed that they seem to require more to sleep. And I notice women who have gone through menopause seem to require less when it comes to sleep. They might take more during the day for other types of things, but sleep, they either have to take it, an hour or two before bed or not right immediately at bed. But that'd be my big commentary on that.